A very good evening to all of you. So some of you have joined us here on Zoom, and I think some of you are also going to join or have joined us on the FB Live. So, well, I'm Dr. Vasudha, the Director of Medical Services of this chain of integrative medicine-based clinics named Vivekananda Health Global. So today, of course, one of the major prominent aspects is pain. And when we talk about pain, everybody says either my head is aching, my back is aching, my knee is aching, and my neck is also aching. So neck pain, of course, can be due to different other causes, but pain in the neck is not perceived, always physically. So another person can also probably cause some pain in your neck too. So just on a very casual note, I just gave this anecdote, but when we want to understand more about pains, the commonest of them today, whether we see it in day-to-day life, maybe somebody in the family is facing it, or when we see patients at our clinics, then also we see the same scenario. So this is what is very well known as lower back pain. So when we talk about lower back pain, then we do understand that there are a lot of aspects which are available, for us to basically understand that lower back pain is preventable and lower back pain is manageable. So when do you first of all say there is low back pain? Very simple understanding that my back is aching. Anything, the back region, which is just above your hip area, is the lower back region. So we are trying to understand the pain in your lower back. So the back, of course, contains the upper portion of your back, the mid portion of your back, and the lower portion of your back. But today's concentration is going to be more so on the lower back pain. So there is this one interesting model, which is said to be the biopsychosocial model of low back pain. Now, what is this trying to understand? Here, what we understand is how there is interaction between the social factors, the biological factors, and the psychological factors. So when we say social factors, so what is this all about? So it could be the economic status. Now, financially, how sound the person is, or does he or she have any difficulty in maintaining, day-to-day activities? Then a lot of cultural beliefs, associated with the social norms. So today we have some religious function at home, or we are doing some other activity. So there are a lot of such cultural beliefs which are very deep rooted, especially in India. And we have an organizational living. So for our day-to-day living, we also need to have a lot of social interaction. And when we talk about the psychological factors, you have stress, one of the most commonly known word, I feel, and I don't need to explain too much on this word stress. And then we have our moods, our day-to-day moods. Today somebody is not happy, or tomorrow somebody is, very, very happy because he or she has achieved something big. There has been probably, maybe if you're in business, then maybe you've got a big deal. So anything can make you happy. And, including very common aspects such as birth of a child at home. So it gives us immense happiness. So next factor is biological factor. So biological factors are genetic factors. Maybe if somebody says, see, biologically, I have this factor of having a weak back. What does this mean? So generation wise, maybe his parents or grandparents have had this history of probably weak bones. It doesn't mean that lower back pain is genetically transmitted. So don't take that wrong. Okay, so you have the vulnerability maybe because you have seen, the problems related to bones and other tissues more commonly in the family. So this has been, so well conceptualized that all these factors, the social, biological, psychological factors, all of them play a very crucial role, especially in the manifestation of lower back pain. Because what do we see? Now, when we are unhappy about something over a period of time, we suddenly start feeling, the head is aching, or the shoulder, the neck is aching, and especially any kind of pain. And similarly, lower back pain also can occur. So that is what I'm trying to give you, as an understanding, saying so many causative factors, and we need to know how can we work around these, so that what we do, what we do not do is very crucial. So that's why we say do's and don'ts of having a healthy back. So for understanding what you need to do, you need to know how it's going to impact you, and what all you can do to probably prevent the lower back pain. So this is just information available which talks about the prevalence of the low back pain. So we know that lower back pain is highly prevalent, because there have been many studies also which say that probably most of them have experienced low back pain in their life. So when we rate different types of pain like hip pain, knee pain, lower leg pain, neck pain, shoulder pain, and many more others, in the list includes lower back pain, you see that 50% of the population experiences lower back pain. Whereas we feel, yes, that maybe, other pains are there, but look at the ratio. No, it is not as predominant as a lower back pain is. And this, of course, is based on certain studies available, and even at our clinics we definitely see larger population of them attending to our clinics or visiting us with lower back pain, and it can affect any age group. So do you think that only elderly are affected? Not necessarily. So it can affect any age group, and it can also be prevalent in particular age groups based on their profession. So we see that people in the IT field, the IT professionals, especially Bangalore is a city which is largely populated with IT professionals, and they are also vulnerable to such problems such as lower back pain. So why am I talking about IT professionals? So IT professionals should not mistake. So we are only talking because we know and we have the data that they are most vulnerable in the population because of associated factors. You sit for a long time, maybe you have to do a lot of calls, you have to work 8 to 10 hours, you may be on calls, you may be on your laptop, you may be working at office, or you may be working at home. And this is the most essential problem of the day, working from home. So the WFH, the work from home option, has also increased the prevalence of back pain in IT professionals. We also, of course, see that as a definite occupational risk, because a lower back pain can just be on and off. Okay, so today I'm facing some pain. Okay, it's just gone away. I think if I just rest and if I just stretch myself, just lie down, it should go away the next morning. Fairly enough, not a problem at all. Now, after 1 week, I again face the same thing. Today again by evening, my back has started aching, and I feel okay. If I sleep and apply some oil, apply some balm, maybe take a hot water bath, it should go away. A couple of times or a couple of weeks or months later, I'm just trying to, bend forward, and when I wake up, when I stand up, I get an excruciating pain. So what do? You hold your waist region. It is so bad that I'm not able to stretch myself back to the standing position. So this is where the problem starts. So we're also trying to understand how you don't go to that level where you have this problem, where you probably don't experience this at all. And, you also wait and watch to say, I will act on it when I probably have the back pain. So we are not waiting, until we have this risk of getting the pain. So when I just now said that all age groups are associated, the highest bracket of this is between 21 to 40 years. So 21 to 40 years is such an efficient age group. Just out of college, people out of studies, mostly at 21, of course, not necessarily everyone, but this is the population data. So most efficiently, they need to work in this age, and that's where childbearing also happens in women, and that is where women especially they have to balance between their work and their life, that is family life. So there are definitely a lot of constraints which are applied between 21 to 40 years, whether it is a male or a female. Everybody has a lot of things to do in this age group. Therefore, this age group also becomes vulnerable to problems such as lower back pain. Of course, when it comes to women, there are many more challenges. It's during pregnancy, during menstruation, pre-menstruation, post-menstruation, many times lower back pain is also a condition associated with certain health problems or women health problems. But during pregnancy, it is more so, because of the kind of pressure that builds due to the growing fetus. But not every pregnant woman also faces lower back pain. Just want to mention that here as well, because you can manage your back, and when you manage your back, definitely the intensity of the pain or the frequency of the pain is going to come down, and there are definitely larger options, for us to basically understand how we can first of all not get it or prevent it completely. So there are different causes for lower back pain. So causes when are just more so divided into two groups. One are your body-based causes. Now there is a strain or a sprain in the back, in the muscle, therefore giving to lower back pain. So many a times we see people coming to us, now I've been having some kind of a lower back pain, only probably from a week or so. I've never had it, but though it's a week, that pain has been there. It's not like too bad. I can manage. I have not taken any pill for reduction of pain. I'm just doing very mild stretches, but probably if I walk for half an hour or if I stand for more than half an hour, I can feel a place of my lower back aching. So now suppose if you consider this as the lower back area. Now, why is this pain coming? Is it due to a muscle strain, sprain, or is it due to a disc bulge? Okay, is it due to spinal stenosis, osteoarthritis, or sciatica? So there are many such problems which can give rise to lower back pain. Now, the most commonest is sciatica. So I think most of you are, do understand this term sciatica. So you have a short picture here to also give you that understanding. So sciatica is a nerve which arises from the lower back area. As you can see, 3 yellow lines, in the lower back areas. You can all see it very clearly. Now it's coming down your hip, coming down your thigh. Of course, this picture doesn't show this nerve in completion, but as it goes down your thigh, it goes behind your knee, goes down towards your calf, and goes down till your toe. Oh, so lengthy, right? It's the longest nerve in the body. That is why it is essential that you don't allow that nerve to get pinched. That is, when there is a vertebral compression. Okay, so you can see the vertebra as well here. When this disc space, this purplish ring which you can see, if that reduces, then this nerve can get impinged. So it's like pinching. Okay, if somebody pinches your skin, how do you feel? You feel the pain, isn't it? Similarly, there is this pain which happens inside, that is in your intervertebral disc space in the lower back area. So of course it can happen in the other parts of the vertebra also, but today, since we are talking more about lower back pain, I'm only specifying on sciatica. So this is definitely preventable because there are different other factors involved in this. How did it just happen? That's where you should know what is the lifestyle you're following. So lifestyle factors which can affect the pain are topmost, of course, stress. Now you will say, how has stress led to low back pain? Stress happens here in the brain, but the pain is in the lower back. So that could be your question too. So it's a simple analogy, because brain controls all pain sensations. And when you're stressed, or you have irritation, anger, emotional disturbances like this, then the pain receptors are also very sensitive. So because of this, you also have the sympathetic plexus, which is very active, and this can increase the pain. It cannot lead as such to the onset of the pain, but it can increase the pain sensations. But stress, when you say physical stress, physical trauma, then yes, it can lead to some injury and therefore can lead to a lower back pain. Sleep, a very, very neglected area. So why should you sleep on time? So whenever you talk about lifestyle, everybody, every doctor you would go will say, please manage your sleep, because we do not understand the toll it can take on our health. Sleeping at 1 a.m., 2 a.m., 3 a.m. has probably become very common these days after COVID, but we need to really revise that time schedule. So even when we say sleep on time, 10 a.m., 10 p.m., 11 p.m., still, if the sleep hygiene, when I say hygiene, it means the number of hours of sleep and the quality of sleep, both are very important. Because if you don't have good quality of sleep, but you're on your bed for 10 hours, that doesn't matter at all. Rather, you be on your bed for 7 hours and have a good sleep. It should be like, I'm sleeping like a log of wood. There is no problem. Please sleep like a log of wood, because that's what your body needs. If somebody wants to wake you, they'll come and shake you. So you don't need to worry about sleeping well and sleeping in such a way that when you wake up in the morning, you're all fresh and agile, because your brain is back into action with a lot of energy. Okay, so that is what we're looking at with good sleep. Now, hydration, enough fluids. Now we are approaching summer in India. Bangalore is already becoming a little hotter. So what is that we need? In winters, we forget about water intake many times because the body doesn't demand much, but still we need to give that minimum amount of fluid which the body needs. So on average, when we say, we talk about at least 7 to 8 glasses of water per day. So is it not? This is a very common thing. So nothing new I am talking about by talking about the quantity of water. And similarly, hydration is essential, because the cells also can wither. If you don't water the plant, what happens? The plant's leaf, first you see them drying up, and if you water, they're also fresh. So nice, right? All of us love to see our garden with especially this, fresh leaves, bloom flowers, etc. Similarly, to keep that freshness going in our body, we need good hydration, and this can support the tissues. So if the tissues have to be healthy, have to have a fair amount of hydration, then you have to give it in the form of fruits, water, juices, in whatever you eat, which is also fluid. And then comes the activity level. So in the activity level, you have physical activity, you have yoga, you have different formats of stretches. So this activity is essential because your spine is movable. It is very, very flexible. So if you are not strengthening your spine with fairly good amount of activity, then you always will have a problem. So therefore, it is said that you have to walk at least 40 to 45 minutes every day, do yoga, do some stretches, and keep your back strengthened. Therefore, it is essential to get on to this. So why? It improves your circulation. Now, if I'm sitting now and I'm sitting like this for the next 3 hours, Is my knee not feeling numb? Is my feet feeling a little odd? Please sense what your body is signaling, because many of us tend to do this mistake that, okay, now I'm sitting for 2 hours, somehow my lower back is kind of aching. Okay, not that it's paining, I can't sit. So please just stretch. It might just take a minute, or just move out of your table, take 2-3 rounds across your room, come back and sit. So all these small little things will make a lot of difference. It's just that we need to apply our thought, and we need to act as and when needed. Next is our diet and nutrition. It's a very important aspect. What we eat is what we are. So this is known. And whatever you give to the body's makeup is also like that. So women are always fond of makeup, isn't it? So they apply maybe some creams, they might use some kajal, they might use a bindi. So all this beautifies them. There's absolutely nothing wrong there. That is a requirement. And similarly, you have to give and beautify your body for a nice glowing face. Always makeup is not essential. You will land up doing a daily makeup if you don't take care of the beauty, inner beauty of your body by supplying it the right nutrition it needs, the right diet. So a lot of things are here. It's just not what you eat in terms of just supplementation, but how you eat, what quantity to eat. All this is important. Many times, what do? We just eat looking at a television or doing something else. So this kind of activity actually is not helpful. Ayurveda has a strong concept of ama. Okay, so ama is an undigested material which can get accumulated in the body, and that can lead to many problems. One of the causes, even books or Ayurvedic textbooks like Charaka Samhita say, is the way you eat. Okay, so fast, if you eat very fast, if you eat very slow, both are not okay. So such is the detail in Ayurvedic textbooks, not just about what to eat, okay, like in terms of leaves, etc., but how you eat is also very important. Now, coming to understanding of what all can we do, to prevent or manage. Now, I've already given you a lot of understanding about the same, but we now specifically concentrate on 3 aspects. How do we bring in physical activity through yoga? How can we modify our diet using diet and nutritive principles? And what does Ayurveda offer in the same area? And how you can really understand all these 3 aspects to have a healthy back. Now, when we want to understand about yoga, there is this information available which talks about how yoga therapy has been used, for different types of pain. And when we see the conditions where yoga therapy has been used, I'm talking about management, it is 48% of the yoga therapy has been used in back pain cases. So see, everywhere that lower back pain is on top of the list. So it is always at number 1 position, because it is so prevalent in the society and people take it very easily, right? So looking at certain postures, what can we include, in yoga on a day-to-day basis? So some of you may not be able to do all the postures. Some of you might need some tweaking, that is some changes in your yoga practice, and yes, you need to consult a yoga therapy expert to understand what you should do and what you should not be doing. But simple practices involves butterfly practice in the form of loosening, and then you have different other joint loosening practices as well. So always start with this, and then bring in some breathing practices, some relaxation in between, and then follow some asanas. So here, this particular image is talking more about asanas. So the butterfly pose, Setu Bandhasana, also known as the bridge pose, and you have the cat pose. So you see how nicely the back can get molded. So when your spine is flexed and extended, okay, then it actually helps in improving the muscular strength. Then you have the cobra, the very well known Bhujangasana, and Adhomukha Shvanasana, downward dog pose. So these are some very commonly practiced postures, but you ensure that you remain in the posture for at least 30 seconds. Now you might have your own problems. Okay, now Shalabhasana, for example, the locust pose. Okay, now this person is very strongly built, you can see him, right? But not everyone is like this. So don't worry, you can do Shalabhasana to the extent possible. Okay, so you should not overstretch yourself right at the beginning, because that can also damage your tissue. So please be careful when you practice, and therefore practicing under guidance of an expert is very, very essential, especially when you are dealing with certain problems such as lower back pain. Okay, so going forward, let's understand why and how it helps. Now, there are two aspects to yoga: prevention and management. So when you talk about prevention, when you do yoga, how is it helping us prevent the problem? So strengthening, first of all, happens when you hold in certain asanas or yoga postures. It gives the required stretch to the muscles, and it also relaxes the muscles. And this stretch and relaxation is a part of the muscle function, and it helps the muscle stay more and more fit, because finally what is actually holding on to spine, it is our muscle. So keeping the muscle strong is very important. It also brings in balance and body alignment. And one of the example here is, say you want to balance in Vrikshasana, you are just a 40-year-old person, but still unable to balance. Two reasons. One, your body is not being trained. Okay. Second, you lack focus and attention. So just keep your eyes open, keep practicing day every day, and slowly, maybe in a period of 2 weeks or 3 weeks, you can do Vrikshasana. That is the tree pose. Because in Vrikshasana, what happens? You're on one leg and the other leg is, flexed, right? Therefore, this is how body alignment will also help, and awareness on the body. So when you are in an asana or when you're doing a pranayama practice, it is essential that you understand what is happening to your body. If your body says, no, I cannot tolerate you being in this asana, please don't continue. You're not trying to become a hatha yoga practitioner, but you only want to keep yourself healthy. You want to become one, you're welcome. So, but I'm mostly talking about the aspect of prevention of health problems. So it's also important, therefore, that we give the strengthening, stretching, balance, and awareness to the body. Breath awareness is also very important for us to have an overall well-being. When yoga is used in management of lower back pain, then how does it help? It helps because it impacts the physical functioning and disability. So we know that the lower back is associated with disability, and disability means your inability to do something, like cannot walk for more than half an hour, cannot stand for more than 10 minutes. So people who have sciatica very clearly tell us this, okay? And when we also assess them before a treatment, when we do at our clinics, then we find that disability score is many times moderate to high. It can further on, how yoga helps is because it can impact pain. That means to say it can reduce pain. And how it reduces, it is once again based on the stretch response and the strengthening the back gets. It also influences the psychological symptoms. So as mentioned, it is important to keep the psychological well-being, because the mind is going to influence the body. If the mind is disturbed, if the mind is always thinking, always active, then obviously your pain is not going to decrease very quickly. We see this, even when I see patients, many respond so well and many take time. I can understand as a professional, but when we explain this to them, it is not easy for them to understand because they've never understood this concept. But the first time somebody is telling them something, they feel she's probably telling because she needs time to treat me. But definitely not. It is because of this complex mind body, the bonding interaction, which influences every other aspect on the body, including a pain such as a lower back pain. When it comes to how we really manage with Ayurveda, we should understand that lower back pain has been explained, very well as Katishula or Katigraha, and there is an imbalance of the Vata dosha in this particular problem called Katishula or pain in the Kati. Kati is back, in Sanskrit, and it therefore affects the muscles, bones, bone marrow, and the seat of this Vata dosha is also the pelvic region. So it is essential to treat and balance the Vata dosha to bring down this pain in the back. And therefore, what do we adapt? We adapt dietary principles, we adapt lifestyle principles, and we also adapt herbal medications or Ayurveda medicines, which are used both at the prevention level and management level. So we also have some dietary recommendations, and this is where people want to know, what do I do in day-to-day life? Yes, to prevent it, do yoga, have good food, follow some dietary principles, and follow good lifestyle. So all of this have been elaborately told in yoga, such as yama, niyama practices, in Ayurveda in the form of dinacharya, and also a lot of pathya or dietary principles. This is in generic nutritional recommendations, dietary recommendations. Calcium is one of the most essential component. It's the bone mineral, which is very much needed to see that the bone is in its shape, doesn't become porous, doesn't become weak. And supplements are commonly available food elements is what I'm trying to specifically concentrate on, such as almonds, dairy, and then you have oranges, tofu, green leaves, all such things which are rich in calcium. Now comes magnesium. So magnesium, why is it key? You may be thinking now, oh, we've not really heard take magnesium when to keep up bone health, right? So it's one of the key element to keep the structure of the bone. And if it drops in the body, then the magnesium is pulled in from the bones, making the bones more weaker. So some common supplements are avocados, bananas. There is many times, right, especially in South India, they say eat a banana after food. Generally, don't take it soon after food, but definitely eat a banana in a day. And that is very rich in magnesium. That is why these principles were made. Now you understand the reason, then you go back and say, oh yes, my mother told me that I need to eat a banana every day, right? Vitamin C is the next element, very important for collagen formation. Collagen is a fiber which bonds the tissues, and it holds the body together. So when you have a collagen disease, you have a problem with this holding on. Either the body feels very stiff and you cannot really manage. And therefore, vitamin C is very much needed for the body. And other elements such as vitamin B12 and iron are also very, very important for good bone health. And we have very common sources, especially iron. And why is iron needed? Because it is that element which helps in the conversion of vitamin D to its active form. So if you are taking vitamin D supplements, or you are in the sunlight, if your hemoglobin is low, then the vitamin D absorption and seeing that an active form for bone health is also going to be low. So you might still experience pain in your joints or in the body. Okay, so overall, just to conclude, the tips are going to be on all these lines. Improve your physical activity, do regular exercises such as yoga, maintain your body weight, which is very crucial, and have healthy food habits, healthy food in terms of good, nourishing food. Use correct ways to manage yourself, whether you're lifting weights or whether you're traveling on a bike, or traveling in a car, and keep your ergonomics in place, especially at your workplace. The position of your table, the position of your chair, the position of your hand, position of your leg, all these are important. And definitely avoid smoking, alcohol, because they also aggravate pain, and manage your mental health well. Most crucial, but very important aspect, because we know that pain has to come. No, we cannot completely keep it away. So it's inevitable, but suffering is optional. So therefore, prevent and work on seeing that you do not get a pain, and even you get it, you can manage it very well. So with this note, I'll end here, and we will also take you through a short practice session. Wherever you are sitting, you can sit on a chair, feel comfortable, and practice with us in the next 10 to 12 minutes. So Dr. Shraddha is there with us. So namaste, Dr. Shraddha. So she's there sitting on a very comfortable chair, and we will do some practices with her. So we are just going to teach you this chair-based module to help you also keep your back fit even at your workplace or if you're at home. But you have to do the regular module of yoga with that. So the first practice we go with is going to be a just simple twisting. So first of all, placing your arms on your thighs, gently twist your back slowly with a deep breath in, and as you breathe out. So see, stretch very comfortably. If you have your arms on the chair, you find it a little difficult, but still you can manage. Now slowly breathe in once again and come back to the center. Now once again, take a deep breath, breathe out and twist. Look at the arm positions, one arm on the chair, another arm on the side of the chair. And once again, inhale, exhale, and slowly come back to the center. So you can do at least 3 rounds when you're sitting on the chair, but today we are just demonstrating only once. Next practice would be forward and backward bending. So easy to do it on a chair. Now just look at it. Slowly start raising your arm. Raise it backward and upward. Tilt your head backward. Now slowly exhale. Start bending downward. Place your palms on the floor and just keep your head hanging. Very comfortable. Okay, don't have to worry even if you have back pain, unless it is severe. Now, slowly start moving up. Inhale. Exhale and drop your arm on the thighs. Now, when you do it 2 more times, you can repeat it, but do it very slowly as we have been demonstrating. The next practice is side stretch. Now, take your right arm up as you breathe in. Slowly start raising the arm towards your ear. Now, slowly start bending towards your left, sliding your left arm. You can place the arm on the chair or leave it hanging also. Now, slowly start pulling yourself up as you breathe in. And start dropping your arm slowly as you breathe out. Now place the right arm on the right thigh and repeat the same practice with the left arm. Slowly take your arms to the sides. Breathe in and slowly take it up towards your ear. Give a gentle stretch. Now slowly start breathing out. Don't hold your breath. Just hold on in the position for maybe 10 seconds. Now once again, push yourself to the center and drop your arm down. Slowly drop your arm down. So this was the side stretch. And then we do another practice, which is just touching your thigh to your towards your chest or abdomen. Pull up the right leg, holding it with both your palms. Stretch it towards yourself. Breathe in as you do it. Now slowly release as you breathe out. Yeah, let's repeat it to the left now. Slowly breathe in. Take your leg towards yourself. Feel the gentle push, pressure on the abdomen. And now slowly start releasing it as you breathe out. Okay. So I think if you have done it with us, I'm sure you would have found some difference and you can share it after this. Now, one last practice to end this module, which is the chair-based module for back strengthening. Let's do a practice of IRT, which is the instant relaxation technique. Just stretch yourself on the chair. Keep your eyes closed. Keep your back relaxed. And just keep your legs on the floor or little above the floor. And slowly bring your concentration towards your foot. Let's practice the instant relaxation technique. Start tightening your toes, tighten your ankle, tighten your calf, pull up your kneecaps, tighten your knee, tighten your thighs, take a deep breath in, squeeze your abdomen in, expand your chest, take a deep breath in, expand your chest. Now squeeze up your shoulders, tighten your palms, now tighten the whole arm. Now squeeze your face and tighten your face. Now tighten the whole body from the head to the toe. Tighten, tighten, tighten. Now release and relax. So this was the instant relaxation technique. After you're done with this, just take a few deep breaths in and out. And chant 3 Omkaras mentally if you're in your workplace. And if you have an option to chant it loudly, please do so. And then take your palms together, gently rub them. Place them on your eyes. And gently open your eyes. Yeah, so this is this short module. If you need to practice yoga therapy in the complete format or the module, you will have to get in touch with us so that we can help you with the same. Thank you, Dr. Shraddha. So I think now things are quite clear. I'm sure you would have practiced and you would have also felt the benefits. So when it also comes to understanding of the Ayurveda therapies, even if you have a mild pain, you can use certain simple measures at home. And we also have some do-it-yourself kits, which are the DIY kits for lower back pain. We, of course, have it for other problems as well. So in case you do not have an Ayurveda center nearby, you need any assistance, you can always use the do-it-yourself kits and get rid of mild to moderate pains. So I think the information exchange from our side comes to an end with this. I'm happy to have you all here. And people on Zoom, you have next 10 minutes to also ask any questions, and you can also share your feedback of this practice you just did along with us. So thank you very much. So do we have some questions? You can type it on the chat box as well. Or you can unmute yourself and ask us.
Thank you, Doctor.
Thank you.
Namaste. While sleeping, what is the position you have to lie down?
Okay, good question. So there are two things. One is if you don't have a back pain, and one if you have a back pain. So if you don't have a back pain, preferably you can lie down straight on your back. And of course, in sleep, you will always lie down to your left or to your right. This always happens, but we cannot avoid. But try to lie down on your back, because if you lie down to one side, like left or right, you're just putting the pressure on one side. So your back is not completely relaxed. But you can always do simple lumbar stretches, before you go to bed, then you feel comfortable. But if you are a person who is used to sleeping on one side, then at least adapt a favorable position. Don't couch. Many people sleep with both legs folded, and they're like this, right, into one side. That is not very well advised. But if you have a back pain, depending on the problem, depending on which comfortable position you feel good, you should just adopt. And as and when the pain comes in, you can take help from your doctor and also sleep in that position.
Thank you, Doctor.
Yeah, you're welcome. So there is the question. My husband is a lecturer by profession, has back pain. If stands for longer time, numbness in heels. Okay. So I think the participant, please understand that if there is pain in the back, and if the person is not able to stand and feels numbness, it definitely needs some intervention. I just showed you the image of the spine. I spoke about sciatic nerve, right? So probably it is pinching his nerve, and therefore he's feeling numbness in his feet. I also mentioned that sciatica, the sciatic nerve travels up to the toes. So if there is numbness in the feet, it is a classical indication that there is some impingement. So please consult somebody, because there are very good remedial measures, and don't wait till this problem aggravates, because it's very painful. We see people who suffer, so please don't get into that bracket. So in case you have anything else, you can check with us. And in case we don't have any questions, because we had just allotted the last few minutes, we can always understand what is good and what basically is not good for an individual. So I hope this was also very clear to all of you. So where should we consult in Hyderabad? Okay, so if you're from Hyderabad, you can, first of all, if you want help from us, from Vivekananda Health, we also have online consultation. So you can come, also consult, and maybe we can refer you to somebody there for therapies. Any exercises for foot drop after back surgery? Oh yes, so foot drop is also very common with sciatica. I did not mention when this previous question came in. If the problem aggravates, you can also see a foot drop there, because the flow of the circulation basically is affected, and since the nerve is affected, and Post surgery also it is very commonly seen. So it is important to also strengthen your low back when it is a post-surgical status. Safe practices, such as bhujangasana, lumbar stretch can be done. But yeah, many more practices can be advocated, but we definitely need to understand the case better. And simple other things are application of oil in the lower back, like I just spoke about do it yourself kits, because you can just do it at home, and that will really not hamper your health. Okay, so I think few tips I can give you. I cannot take this in detail because it's a very specific question, and I might mislead you. So that's one of the reasons. So yes, I think we're also now winding up with respect to the time. So if since we also don't have any further questions, let's also close for today. So we will keep interacting with you and also give information, whether ranging from cases or conditions of pain to maybe conditions of anything else which may be acute or chronic. So you can therefore write to us, or just get onto our website to get more information if you're looking for any. So thank you very much for joining us. And I think your questions are also very insightful. So let's also close the session with the Shanti mantra. And this will also help all of us to stay more tuned for today, because it's a Saturday evening and we have our own work profile now waiting for us. Like I have consultations waiting, so it's good that I get tuned with the Shanti mantra and start that next part of the day. So you just keep your eyes closed. Let us do 2 minutes of this practice. Let us start by taking a deep breath in. Breathe out. Breathe in, concentrating on your abdomen. As you breathe out, chant aloud Omkara. Om. Once again, holding the Namaskara Mudra on your heart chakra, take a deep breath in. Om. Once again, Om. Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani pashyantu, ma kaschid dukkha bhag bhavet. Om Shanti Shanti Shanti.